welcome everyone. I'm Adalsteinn Brown. I'm the Dean of the Dalla Lana School of Public Health. And it's my real pleasure for the school to be able to partner with Massey College, with the Friends of CIHR, and with Dr. Abby Angel to host today's session. I'm going to just make a couple quick remarks and then turn it over to my co-chair, Dr. Chris Simpson, who I'll introduce. And then we'll work through the program of today's events and make sure that we get everyone out well on time this cold morning. Look, I think science has risen in a way that is really, I think, both remarkable and reassuring, and it sometimes actually shows the great challenges that still face science during the pandemic, particularly in the way that it informs policy. I had the chance to chat with some colleagues in the UK yesterday, and one of the points they made was the survey data that now shows scientists have risen in trust. Clinicians have always been high, but scientists have risen in trust. And I think this points to the importance of science advice, importance of science and science advice, really thinking about how we respond to a global crisis like the pandemic. But it also, I think, kind of prompts what we do next and how we start to think about the next time, whether it be the next pandemic or just how we continue to make sure that science informs a stronger and a more just society and health system. I'm joined today as my co-chair by Dr. Chris Simpson. He's the Executive Vice President at Ontario Health, where we work together. He's been instrumental in guiding the provincial response to COVID-19. He also works clinically as a cardiologist at Kingston Health Sciences Centre, where I believe he is today, and he's a professor at Queen's University Department of Medicine. Amongst many other things, Chris has been the president of the Canadian Medical Association and the Canadian Academy of Health Sciences, and he's held a number of previous positions, including being head of cardiology, and a vice dean at Queen's Faculty of Health Sciences and medical director at the CMO. And you may not know this, but he's also an accomplished, and by this I mean professional level musician. Chris, let me turn it over to you.
Thanks very much, Staney, and thanks and welcome to all of our speakers today, as well as to all of you who've joined in remotely. I just wanted to take a couple of minutes to reflect a bit on the past couple of years that have been defined in many ways by the pandemic and by the considerable death and disruption that it has wrought. It'll be many years, I think, until we really fully understand the totality of the impact on our society, on our economies, on our social constructs and social order, on our politics and our freedoms, and on the health of all of our citizens. In our health system, we've seen a prolonged disruption that I think we would all agree has been like no other in at least a generation. With every wave of the pandemic, as it has waned, our health system planning has tried to turn from crisis management to recovery. Thinking at first about recovering the care deficits that have been accrued, things like the missing cancer screening, the deferred surgeries and procedures, the childhood immunizations that were missed, the new symptoms like shortness of breath or chest pain that were set aside because of hesitancy to access healthcare or to be in healthcare venues, or the surges in conditions that require more attention and resources. The tragic increase in opioid-related deaths, for example, the increases in anxiety and depression and eating disorders. But recovery, I think, really is so much more than that. It's perhaps not so much about what we intend to recover from, but what we want to recover to. There's no doubt that all of us feel a collective urge to do whatever we need to do to return to the psychological safety, if you will, to the status quo. We just want to get back to normal. We want to return to our normal lives. But the pandemic has taught us, I think, some lessons that we would be wise to pay attention to. And the first and most important one, I think, is how the pandemic has exposed historical health inequities. We've all known that they were there pre-pandemic. We've appreciated this intellectually, even scientifically. But now I would submit we feel them differently because there they are with all the sharp edges exposed. And we've seen in real time how the crisis has made them even worse. And we're also seeing how the gap will not be closed unless there's a deliberate, specific plan with objective measurement and accountability. So we don't want to return to the way things were. We want to recover to something better, to a system that's truly worthy of the confidence and trust of all of us, not just those who have enjoyed privilege. And the pandemic has also exposed the folly of siloism in our system. We speak of healthcare sectors. We organize our system as a series of encounters that require transitions, as though our bodies are a federation of organs that require individual care plans by different providers for each individual thing that's wrong with us. And of course, it's at these transitions where mistakes are made and where inefficiencies are generated and where suboptimal outcomes are born. So we don't want to return to the way things were. We want to build a more integrated system that delivers a more integrated care experience for those we serve. And then finally, there are plenty of challenges, not the least of which is that the pandemic is not done with us yet. We're all watching the Omicron story, of course, with bated breath. Will this mean that we'll have a bump in the road, or are we going to have a significant setback, or something in between? This is something we won't know for a few more weeks. The burnout in our healthcare workforce. This was a problem before the pandemic. Now I would say it's a crisis. And in the context of recovery, no matter what angle we take to discuss and plan recovery, all roads, and I mean all roads, lead back to health human resources. And there are many questions we'll need to answer. What is to become of virtual care? How will we pay for recovery? And are we brave enough to embrace social care as a key component of the plan to achieve the best health in all of our people? So I'll just finish by suggesting that this time of disruption and these big, hairy challenges provide fertile ground for bold thinking and bold action. And I'm very much looking forward to hearing from our speakers today on the critical role that science and science leaders can and should play at this very important moment in our historical evolution. Back to you, Steini.
Thanks, Chris. With that, I'm going to jump straight into the program and start by introducing Dr. Abhi Angel, who will then introduce Professor Sir Mark Walport. Like many great Ontarians, Abhi's actually from Manitoba, and like me, you've got Manitoban roots. You know the importance of that. He was the head of internal medicine at the University of Manitoba. He had a driving role in the foundation of the Canadian Academy of Health Sciences and in the Friends of CIHR. And he actually co-founded as well the Canadian Society of Endocrinology and Metabolism. Abhi, can I turn it over to you to introduce our guests? And I'll stop by just saying thank you for the opportunity to partner with you today.
Thank you, Steini. It's wonderful to be here today. Greetings from the Upper Library of Massey College at the University of Toronto, where Friends of CIHR is based. My name is Abhi Angel, President of Friends of CIHR and Chair of the Friesen International Prize Program. It's a great pleasure to introduce Sir Mark Walport at this roundtable. He is our 15th Friesen Prize winner, in fact. Professor Sir Mark Walport is a visionary health research planner and a champion of fundamental science in health research, engineering, technology, and innovation. He obtained his clinical and PhD degrees at Cambridge University and trained clinically as a rheumatologist. Prior to entering government, Sir Mark was Professor of Medicine and Chair of the Division of Medicine at Imperial College London, Hammersmith Hospital. In 2013, he was appointed the UK government's Chief Scientific Advisor and head of the government's Office of Science. In this role, he provided advice to government at the highest level on a range of crucial scientific topics, including climate change, digital infrastructure, and agriculture. In 2016, Sir Mark became the first chief executive of UK Research and Innovation, which brought together research funding agencies with a total budget of 12 billion Canadian. Sir Mark has also been an ardent supporter of the arts and a popular spokesperson for science and innovation, and most recently on the state of COVID mitigation. He has been the recipient of many honors and prizes, including 10 honorary degrees and a knighthood in 2009. In June 2020, he was awarded the 2020 Henry G. Friesen International Prize in Health Research. Thank you, Sir Mark, for being with us today and this week in Canada.
Thank you very much indeed, Orby, and I'm delighted to be here and participating in this interesting seminar. So I want to pick up a number of the comments that have just been made in the introduction. Firstly, on this point of trust in scientists, one has to be very careful about these general surveys because trust is actually entirely context specific. So scientists are definitely trusted when they're talking about things like the Higgs boson. And so if a physicist goes on the television or the radio and talks about the Higgs boson, he will likely get, or she will likely get, criticism from other physicists, but the public will trust implicitly. Equally, of course, journalists usually come out at the bottom of the sort of trust measures as a whole, as do politicians. But actually, we trust a journalist to tell us the hockey scores implicitly. And so trust is entirely contextual. And one of the things I rapidly discovered was when I became the government chief scientific advisor, that scientists are much less trusted when they start talking about things that affect people's human lives or where the science conflicts with values. And so when you start talking about the culling of badgers to control bovine tuberculosis, or indeed the use of neonicotinoid pesticides to improve crop yields, you suddenly find you're much less trusted. And so I think that one's got to be quite careful about these surveys of trust because it actually depends on the specifics. And as the very distinguished philosopher Nora Neal always comments, that trust depends on behaving in trustworthy fashions. And so I think that's a really critical issue for science and science advice. And I want to pick up the three things that Chris just said. So firstly, you talked about the trade-off that one of the consequences of coronavirus for health has been that we've put an enormous amount of focus on the management of the pandemic. But as part of that, great efforts have been made to stop health systems becoming overwhelmed. But nevertheless, there are adverse mental health consequences of being isolated and quarantined and social distancing. People have not presented for early diagnosis of cancer. Childhood vaccinations have dropped. And so there is immediately a policy question about the balance between how strictly you control the spread of coronavirus and other consequences for health and society. And so people losing jobs is bad for them in the long term. Secondly, you've talked about the health inequities. And of course, coronavirus has exposed those social determinants of health that were described so well by Sir Michael Marmot and his colleagues at University College many years ago. And I think one of the big lessons that comes from the coronavirus pandemic is that we have neglected our public health for a very long time. And as I commented in my talk yesterday, one of the challenges is that we talk about health systems, but they're largely disease systems. And so when there are queues of people waiting for cancer treatment or for cardiac surgery or for anything else, that is highly politically salient. Money follows quite rapidly. When you talk about interventions that may affect health 20 years on or 50 years on, they are less salient. And so there's been less money devoted to public health care. And so when you talk about building back something different, what you're talking about is actually politics, because scientists and medical professionals can't do this on their own. And so we're immediately into the territory as to where science meets politics, because of course, policies in Canada and in the UK and in other democracies, the policymakers are ultimately the people that we elect as politicians. And so I've spent a lot of time sort of learning and thinking about this whole question about the relationship between science advice and policymaking when I became the government chief scientific advisor back in 2013. And I think it's important to recognize, Churchill put it quite nicely, actually, when he said that scientists should be on tap, but not on top. And policymakers, when they make policy decisions, look through three lenses. So the three lenses they look through are, what do I know about X or Y? And that, of course, is where the science advice comes in. They look through a second lens, which is, if I make a policy, can it be delivered? because people are always coming up with great ideas for policies. You know, everyone knows the answer, but many of the ideas are absolutely undeliverable in practice. And then the third lens that policymakers look through is, how does this policy fit with my values? My personal values, the values of my friends, my religious values, my political values, very importantly, and of course, what are the values of the people that I think have elected me? And it is often the values element of that lens that trumps the others. And so it's really important that one understands the role of evidence in making policies. Now, it's perfectly true that in an emergency, political values are usually less in the fore than they are if you're dealing with social policies, for example. But some of the things you've raised, so the health inequities, are very, very political, because actually the solutions to them, and of course many of the solutions to public health, lie outside the traditional levers of health departments. So public health is actually, it's about education, it's about housing, it's about transport, it's about how social care is provisioned. And these are very, very political decisions. And so I think it's important to work out how to engage in the most effective way. And particularly when you're in the role of a scientific advisor, understanding what your role actually is. I spent years actually with people asking me, you know, how do you cope with the fact that politicians are constantly neglecting your advice? And the answer is that actually they always listened very, very carefully. I didn't have that as a problem. But anyone who watched Tony Fauci standing behind or beside President Trump could see from his body language what he thought about it. Although inevitably, as a public servant, he had to be quite restrained in what he absolutely said publicly. And the role of a science advisor to politicians becomes immediately compromised if they start broadcasting their advice via the media. And so whilst people always wanted me to shout at government through the radio, the television, the newspapers, actually, I would have completely lost any possibility of being an effective scientific advisor if I'd started to do that, because I would have lost trust with the people who had actually appointed me to advise them. And they did listen, but they didn't always do what I would have done if I was a politician. But I'm not. And another question that frequently came up was, why aren't there more scientists, engineers, technologists in Parliament? And I suspect that's an issue in Canada as it is in the UK. It was sort of posed to me as though it was somehow my fault that it wasn't. But the answer that I would always give is, you can't really blame the people that are there because they've stood for election. You can only blame the people that aren't. And of course, part of the challenge for scientists and physicians is that by and large, we're culturally very untuned to become politicians. That's not sort of part of the career expectations. And I think it raises another quite interesting question, actually, which is, I think, a challenge to the whole education of scientists, researchers as a group. And I should say, when I'm talking about research, I strongly include the social sciences. You know, one of the big challenges of coronavirus and is, for example, the opposition, which to, I suspect, everyone on this call appears completely irrational to the administration of vaccines. That is, in fact, historically, a very old phenomenon. The anti-vaccination goes right back to the time of Edward Jenner. So we need the social sciences if we're going to tackle these problems as well. But there's a lot more I could say, but I'm constrained in time. But one thing I would say is that I think we need to think about how we educate scientists much more carefully. So if one of our children goes to university to read history, no one says to them, you're going to be a historian. History is recognized as an education for life. On the other hand, if, as one of our daughters did, she went to university to read chemistry, everyone said, you're going to be a chemist. And so we tend to treat science as a vocational education, whereas actually science ought to be an education for life. And as such, we need to see scientists participating in all walks of life. And of course, a science and indeed a medical training gives one skills for life. It educates one to be numerate, to be questioning, to be skeptical, to be rigorous, the important values, and to communicate effectively. And those are the skills that you need to succeed in almost every walk of life, including politics, actually. And so I agree with you that I think that we do need to learn the lessons of COVID, of which the most important, in my view, is that we have neglected public health for so long. And certainly when you look at the demography of the harms of coronavirus, you see that they correspond with poverty, with poorer education, with all of those factors that Michael Marmot and others have described as being important in chronic disease, but are equally important in infectious disease as well. And so I think that if we want to change things in the future, then I think as good citizens, and I think that we do need as scientists, as medics, to be good citizens, but we've got to be very careful that we don't appear as being superior, that somehow because we're scientists, we know the answer, we know what the policies should be. And actually, historically, when scientists have become ministers, they often don't do very well at it, actually, because they don't have all the skills. And so I think that we need to be humble, but vocal citizens, presenting the evidence clearly and as far as possible unemotionally, and participating fully in the democratic process, including if we really want to make policy, then the only way to do it is to either become an official where you can influence policy from inside government, or formally become a policymaker by becoming a politician. And I suppose one last remark is that I think the other inequity that has been very exposed by coronavirus, but is an issue with climate change and environmental degradation as well, is that the young have been harmed very significantly in looking after the old. And I think that our generation, more perhaps than any other in recent centuries, has taken a lot away from our children. And sadly, they don't have the same inclination to express their democratic voice as older people do, who tend to vote more. And so the old have disproportionately much more political power than the young. And I think that's something we need to think about as well. So hopefully that's been sufficiently provocative. Thank you.
Great, thank you. Look, we're going to now move on to our panelists. And the first one is Dr. David Naylor. Among many accomplishments, David was the founder of ICES and served as the inaugural director of the Clinical Epidemiology Unit Research Program at Sunnybrook. In 1999, he became the Dean of Medicine and the Vice Provost of the University of Toronto, and became the President later on from 2005 to 2013. In 2006, he became an Officer of the Order of Canada, an award that adds to a substantial pile of well-deserved honors and recognitions. And he's provided national leadership during the pandemic as the co-chair of the National Immunity Task Force. And I'll just say that were it not for his help to a very sort of confused and challenged graduate student about 20 years ago, I wouldn't be at the University of Toronto. So it's with great thanks I introduce Dr. David Naylor.
Thank you very much, Steny. I'm hoping that I'm sharing an image of my aged countenance rather than the remarks I have on my screen. So if I've got my remarks up there through share screen, tell me right now, otherwise I'll get going. Thank you for the kind words. We have 6 minutes to try to do justice to a difficult topic. So I'm going to start with a telegraphic summary. We're still dealing with this pandemic day to day. But what I'd like to do in these brief remarks is reflect a bit on where we've been and how we might take stock, gather data, and generate advice in a way that really does help us to do better next time. I have to start, however, by congratulating Sir Mark Walport on adding the Henry Friesen International Prize to his many laurels. Sir Mark, thank you for crossing the Atlantic in this period of uncertainty and renewed travel friction. I enjoyed your illuminating remarks on Monday and again this morning. And I would say that, like Professor Walport, I spent a lot of time in policy advisory capacities to governments through the years. I think my first outing in that regard was 34 years ago. But I've never been on the payroll, so never in the bowels of the beast, so to speak. So, Sir Mark, that's one experience that you have that none of us, I think, can speak to this morning in quite the same way. Remarkable experience. I want to echo Sir Mark's remarks in one respect, and that is, what is clear as you give that advice to politicians and senior bureaucrats is that, like clinicians, they're making decisions on the basis of a triad. There are the facts or the evidence that we try to generate and share with them. There are the values or preferences, often conditioned by political ideology. And then there are the contexts or circumstances. And as we all know, those of us who've been close to that machinery, the electoral cycle is one of those contexts or circumstances that has a big weight on how advice is taken or not. And similar to clinical decision-making, there are lots of gray zones where the evidence is conflicting or incomplete. Now, it's pretty obvious that in a pandemic of this proportion, we have so many uncertainties. So, Mr. Mark said, the emergency imperative drives the science to the fore. But as all of us have seen, it's also a period where, despite the remarkable use made of real world evidence and some wonderful experimental evidence gathered along the way, there have been a lot of twists and turns and uncertainties. And so I want to turn to the title of the brief remarks, and that is Beyond Adequate. And let me start by emphasizing that adequate isn't how I describe the Canadian public's response. I think our fellow citizens have been brilliantly compliant. They've been patient, they've been resilient, and a lot of the success that this country has had in combating COVID-19 is due to the way Canadian citizens have risen to the challenge. And obviously that isn't how I describe the response by frontline healthcare workers and public health teams, or the amazing community partners and volunteers who have helped so materially during the pandemic. That term adequate is what comes to mind when I think of how Canada's governments, national and subnational, have done. I have tried to be more expansive, but the words that come to mind just aren't superlatives. They're very Canadian: good, fine, solid, or per the title of this talk, adequate. Let me emphasize that that's the average. We range from some very fine federal, provincial, territorial cooperation early in the pandemic to fractiousness for almost a year now. We've gone from a relative dearth of vaccines in the first quarter of 2021 to an abundance of effective and safe vaccines as a result of fine recommendations from an expert panel, great advice. This is the Vaccine Task Force, of course. That was advice given and taken, coupled with strong procurement work by Minister Anita Anand and her team. We've had some very good non-ideological decision-making in the Atlantic provinces as they responded to the pandemic. But also, if I may be direct, some decisions in multiple provinces at different times that cost lives. We can't sugarcoat this. Some of our fellow citizens are dead because government did not take advice, or because advisors were co-opted by governments driven by non-scientific considerations. As has been mentioned, others were sickened or carried off as the pandemic took a highly differential toll on society. Stark evidence of the social determinants of health to which both Chris Simpson and Mark Walport alluded. And I would add that we've also seen that our public health measures, the so-called NPIs, also had a differential impact on those who were less advantaged, an unhappy side effect of what was done to combat the pandemic. So where might advice come into this, particularly if we start to do some stock taking at some later point in time when things have receded? And here I want to emphasize something that Mark Walport said yesterday and again today, and that is, those of us who give advice, those of us who take stock, don't have to face the electorate. And it's at times incredibly frustrating, at other times in some ways easier to be on the sidelines talking to each other, dropping commentary into that echo chamber of confirmation bias, sometimes known as Twitter. Most of us don't have to make the tough policy decisions or listen to the blowback from stakeholders or from the experts after those decisions are made, nor do we have to contemplate how those decisions will be perceived by voters when next they go to the polls. And I want to elaborate on something Sir Mark said. You know, we can think that if we were in public office, we would make different decisions. But I sometimes wonder just whether we would be able to withstand some of the pressures and the cross currents if we were all sitting in a ministerial seat. In any case, the fact remains, not all advice is being heeded. Failure to heed it in this country has at times led to tragic consequences. We've seen the inadequacy of some of our machinery, our infrastructure, and our infrastructure, and we must do better next time. to be better than adequate. Here I want to come back to something that Sir Mark said in Monday's Friesen lecture, that most countries are much better prepared for the last disaster than the next one. Wise words, I think. And so obviously the most urgent science advice is what's required to manage the twists and turns of the current pandemic, to throttle back SARS-CoV-2 so that it constitutes a low-level endemic cause of primarily seasonal illness, leading to serious illness in a very small number of citizens here and in every other nation on the planet. But the most important science advice may well come as we take stock and rebuild and reset so that we're better prepared for the next pandemic. That review or set of reviews has to be comprehensive, honest, and fair. It has to avoid glossing over what's happened. And as I've said publicly in the past, we also need reviews that are not only federal, but national. We can't simply go ahead and run a set of provincial or territorial reviews in the usual Canadian way of building silos. We have to put the whole picture together and see how the collaboration occurred across the country from sea to sea to sea. I also believe, and I've again said publicly, that those reviews should be led by international experts who can call things exactly as they read them and see them, with full independence and full access to the relevant records. Why internationally led? Because frankly, the pandemic has engaged so many of us coast to coast who are interested in and involved with epidemiology and public health and infectious disease. We need the objective look from those who can lead a panel and give that international or global perspective to help us understand where we fit in the global scheme of the response to COVID-19. After that, there's another place where advice and advocacy have to coalesce in the years ahead. And that is to mean vigilance about the implementation of those recommendations and the maintenance of our response capacity. It can't be just rote reinforcement of what the expert reviews recommend. There has to be improvement and adaptation to avoid the pitfall that Sir Mark highlighted. May I say that I think we already have ample evidence that both our federal public health agency and this province's agency were not given the level of support and attention they needed, and that the public interest demanded. And as others have said, we clearly have a massive amount of work to do on the social deterrence of health. In any case, vigilance and advocacy are going to be an integral part of the science advice that I hope all of us can offer to ensure that Canada does better next time. Thank you for your time.
Thanks, David. Moving on, it's my pleasure to introduce the next speaker, which is Dr. Samira Mubarak. Dr. Mubarak completed her fellowship at the Mount Sinai School of Medicine in 2009, and since has continued to study viral transmission and spread of disease through multiple lines of inquiry. In the early days of the pandemic, Dr. Mubarak and her colleagues isolated the SARS-CoV-2 virus in a level 3 containment facility. It's now the principal source of SARS-CoV-2 to most academic CL3 laboratories across the country. And not surprisingly, she serves on the Chief Science Advisor of Canada's COVID-19 expert panel, multiple committees, and on the Ontario COVID-19 Science Advisory Panel, where I've had the pleasure and the privilege to work with her. In 2020, she formed the Sunnybrook Translational Research Program for Emerging and Respiratory Viruses to focus on viral genomics, transmission, and the development of medical countermeasures. Samira, I'll turn it over to you, and I'll put your slides up now.
Thank you very much, Dr. Brown. So I took advantage of sending some slides along because my chat will be a little bit more technical. If you don't mind, Steiny, going to the next slide. So really, I wanted to talk to you today about assessing risk in terms of novel viruses. This is something that is not new at all for those of us who've been working in influenza virus and emerging influenza viruses. There are a number of different tools that people can use to understand the risk of novel viruses. And, you know, given the global virome, both inside and completely around us, there's no question at all that we will be detecting novel viruses. Surveillance is absolutely essential, and something that we've really neglected in our approach to surveillance is pre-emergence. So when I say pre-emergence, I'm referring to wildlife reservoirs. We're quite good at doing human surveillance. That's something that we do on a seasonal basis every year with influenza virus and other viruses as well. We're not bad at looking for viruses in animals that are of economic importance. In other words, agricultural animals, specifically poultry, swine, etc. But where we haven't really been paying much attention, and I think at our peril now, we've learned the hard way, is in wildlife. There are a number of different reasons for this. Obviously, there are challenges around doing this type of work. It's been significantly underfunded for decades and decades. And also, the technical tools really weren't that great for a long time. We were very limited in terms of what we could actually use for virus detection. Often serology, which is indirect, more recently PCR, but even more recently than that, we can now use tools such as genomics. So as I mentioned before, this is really not a novel challenge. We've had a number of avian influenza viruses that are new subtypes that have emerged over the last couple of decades. And both the WHO and the CDC have established tools or frameworks to assess the risk associated with these novel viruses. So this is one example here. This is from the WHO, TIPRA, the Tool for Influenza Pandemic Risk Assessment. And a lot of the elements that are included here can also be used for other novel viruses. We certainly will be detecting new coronaviruses in the coming years. Paramyxoviruses are also going to feature prominently, I anticipate. And really the approach to this is very multidisciplinary. And I think that's another point that is really merits highlighting here. We can't address pre-emergence and risk assessment without a multidisciplinary approach. If I were to create three different, elements or groups of elements, looking at clinical implications, epidemiological implications, and biological information. All three of these are absolutely essential. And as I was listening to Dr. Simpson and Sir Mark Walport, I understand that one thing that's really missing from this are the social aspects, right? How can you really do a fulsome risk assessment if we're not including those aspects? So that's something that we really need to start thinking about, I think. So just to take you through this very briefly, clinical disease severity is obviously essential to understand. Some of the epidemiological features are key. So population immunity, as well as distribution geographically and also across different species. And then biologically, understanding what the biology is for a virus is really essential. There will be far more viruses that don't have the potential to become human pathogens because the biology just doesn't fit. So understanding things like host cell receptor and cell permissiveness and host permissiveness are really essential. And I'm including here at the bottom the changes. Many of you will recognize this figure from the Omicron genome. And this is why I chose that first picture, the wolf with teeth. I described this virus, Omicron, as a virus with teeth and fangs. And the reason we understand some of the risk from this particular virus is because of the data that we already know or that we've already generated from pre-existing variants of concern. So we have a sense of what it means when we find a new variant that has changes in 501 or 484 or 681. We're really building on existing knowledge. We need to continue to do that. If you don't mind moving to the next slide. Thank you. So it's one thing to understand things in a human context. What about the broader context? When we find something, it's most likely going to be in a wildlife or animal reservoir. What are the implications in this case? And most recently, I think we can use this as an example, the first case of SARS coronavirus 2 detected in Canadian wildlife. So Dr. Simpson alluded to the folly of silos, and I think this is where it's important that we really need to actively break down these silos. So in a collaboration with CFIA and the Public Health Agency of Canada and provincial wildlife biologists, we were able to detect this virus in deer. We were able to sequence it and determine infectivity. This is something that we did as a group organically, and I think one of the key messages here is that although we were able to bring the data up to date from this perspective, we really don't have a broader sense of the implications long term. And most likely, these are going to only reveal themselves with time, as we have to, now we're actually compelled and committed to doing ongoing surveillance in deer now that we have found this, because of the possibility of spillback into humans, possibility of evading medical countermeasures, including vaccines, and also the broader implications for populations who depend on these animals for food security, country foods. This is something that we really need to address up front. So I'll hand it back to you, Dr. Brown, and look forward to the conversation.
Thanks a lot. It's my pleasure now to introduce Dr. Kwan McKenzie. Dr. McKenzie is the CEO of the Wellesley Institute, a full professor in the Department of Psychiatry at the University of Toronto, an international expert on the social causes of illness and the development of effective, equitable social policy and health systems. He's also the Director of Health Equity at the Center for Addiction and Mental Health and a practicing psychiatrist. If that wasn't enough, he's also a remarkably productive scholar with over 240 papers and 6 books, and is a past BBC radio presenter and columnist for The Guardian, Times Online, and most recently the Toronto Star. And he's also someone who many times has given me just the exact sage advice that I needed to figure out what to do when I'm confronted by some particularly challenging situations. He has a number of awards and memberships at the provincial and national level. He holds an African Canadian Achievement Award for Science, a Harry Jerome Trailblazer Award, and a Dominican of Distinction Award. And during the pandemic, Dr. McKenzie's convened a broad coalition of academics, clinicians, and communities that drew attention to the inequitable impacts of the pandemic and the need for the collection and use of socio-demographic data. And this work appropriately has been credited with changing pandemic strategies and has attracted international attention. Kwame, over to you, please.
Oh, well, thanks very much, Danny. I'd like to start by thanking Professor Walport for his comments, Dr. Naylor for his wise words, as always, and Dr. Mubarak for her spectacular demonstration about how to make complex things accessible, which I just loved. And of course, you, Dr. Brown and Dr. Simpson, for the framing the subject inside the pandemic and recovery, but also because of the prominence of equity in your comments. Now, I am going to make 3 provocative points for discussion. I'm going to make them in a slightly lighter way, but you can see that they align with comments so far. So the 3 things I'm going to talk about is, the first is we may want to be more emotional and understand values. The second is we need to spend more time thinking about our relationships. And the third, if we actually drop the ball on equity, if science drops the ball on equity, then it brings science into disrepute. So be more emotional. So I want to start off by talking about the thing that I'm really interested in science fiction. I'm going to talk about Star Trek. Now, as you know, Star Trek is an $11 billion franchise, which has been with us for 55 years. But Star Trek is really about morals and values. Each episode, the cast boldly go where no person has gone before, but ignoring the new worlds, where they're really going to is from one moral dilemma to the next. Fundamentally, Star Trek is about what it is to be human at the end of the Cold War. But the sub-narrative is the relationship between Spock, who is part Vulcan and so governed by rationality and science, and Captain Kirk, who's a values-driven, emotional American. And though Spock is often the brunt of the joke, the resolution is usually that Kirk needs Spock's rational, strategic, scientific mind in order for the mission to be successful. And really, it's the same triad as Dr. Naylor sort of so eloquently stated. The leader is human values, the foil is science, and the context changes as they boldly go from one planet to the other. But this narrative is important for anybody who wants to inform policy, especially during difficult times. And it sort of reminds us about Robert Wright's book, The Importance of Public Ideas, because we all know that it's easier to move policy forwards if it can be attached to an existing public ideas. And actually you see that in every populist leader. it's actually very difficult to change the narrative. And the current zeitgeist is that we are only ready to be led by Spock when in extremis and temporarily, that when we're back to normal, science does not drive the bus. And there is actually science to support that this balance is important. Psychological research demonstrates that when we make better decisions, when we engage both our emotional and cognitive elements of the problem and of our minds. When we understand and reconcile the difference between what the best thing is to do, what the right thing is to do, and what we want to do, we make better decisions. And we've seen this classic tangle in sort of thinking about these issues and between Spock and Jim, if you want to put it that way, during COVID. And we've made loads of mistakes. We've used emotions and values in a haphazard way to push forwards public health strategies. We at times have scared people into compliance, but our lack of real depth of understanding about how we use the science of emotions, how we understand values in order to produce change. And I don't mean behavioral change, I mean the sort of cultural change that we need to not just get things done at the moment, but to keep things done in a non-divisive way. There are things we haven't been thinking through. We've focused on getting things done rather than how to maintain them. And we actually need to be much cleverer in how we understand the science of managing emotions and the world of values if we're going to be able to give advice that helps our population not run the sprint, but runs a marathon, and how we give advice on dealing with the things that are coming to us now, which are community resistance, industry resistance, and government reluctance. And I think we might have a better way forward in doing that if we understand the second thing I was talking about, which is managing our relationships. So about 7 years ago, in order to improve my mental health, I bought a farm, but also in order to improve my mental health, I don't farm the farm. There's a farmer who farms a farm. And I was trying to explain to the farmer what we do at Wellesley. So I used an analogy. I said, well, what we do is we have these ideas, and these ideas, these research ideas, are a bit like seeds. We grow those ideas, and that's our doing research project. And then we create out of them a policy idea. And then once we've created the policy idea, we take that out to market, and we go to our stakeholder groups, and we go to policymakers, and we go to governments, and we shop the ideas around. And the farmer looked totally glazed over, and I thought, oh God, I've lost him here. He doesn't really understand. And then he stopped and looked at me and he said, that really doesn't make any sense at all. And I said, well, what do you mean? He said, well, I would never put a seed in the ground if I didn't know what the market was. We don't grow things on spec. We grow things to a market. We understand our markets. We understand what we can and can't do, and we grow our produce to meet the market. We don't just grow on spec. Are you sure this is the right way to be going? So this was his challenge to us. And the challenge was a challenge that we took up at the Wellesley Institute, because we started thinking much more carefully about how we build relationships, not just with government, with the community and stakeholders. And we tried to develop clarity about how we have relationship-based policy leverage, and how we, the things that we all know when we give advice. The right information is important, but the leverage comes when it comes from a trusted source, and how we develop that position as a trusted resource, and we maintain that is really important for our mission of trying to improve health and health equity. And I really loved some Mark Walport's comments, because this is my view is that both Steny is right and Mark Walport is right. In some places, science is seen as much more trusted, and scientists are seen as much more trusted. But in many other places, society is now seeing science as less trustworthy, and that is something we've got to reconcile. So just to finish off, little word about equity. As everybody's already said, the pandemic has taught us a lot about our societies, and it's taught us that we are most vulnerable nationally and internationally when there are inequities, and COVID feeds on our inequities. It has taught us as a country that we talk a lot about decreasing inequities, but there's a huge gap between the positions we take and our intentions. We say inequities are important, but their importance seems never to be as big as other things. And so we presided over significant international and also national and even regional inequities in the impacts of COVID-19. And this is partly politics, but we also see it in science. And this underlying theme is something that we have to think about if we're going to make the world a safer and fairer place. And it's something that science has to deal with if we think we're going to be a unifying factor or a unifying language that the world will get behind. We have to understand that science has the ability to increase inequities, and it usually does so. And that unless decreasing inequities and unless human rights are the key to the scientific endeavor, we will continue to make the world maybe a better place, but not necessarily a more equal place. Because people are arguing that climate change, the economic system, modern warfare, including drones and nuclear weapons, all byproducts of science. People are arguing that modern media is undermining traditional values and is a major problem. People are arguing that poorer nations are doing worse and faring worse out of this. And people are arguing that we need less science and more tradition. I do not agree with that, but I hear it more and more. And so I would argue that if we want to be central to the future, we actually have to prove ourselves to be a force for equity. We have to understand how to do that by developing our relationships, and we need to understand how to balance our knowledge of sort of science with that of emotions, and as Sir Mark has said, with values. Thank you very much. I'll leave it there, and I look forward to the discussion.
Thank you. It's now my pleasure to introduce our last speaker today, Dr. Carolyn Tu. Dr. Tu is a hugely well-read and influential scholar. Books that are in many classrooms and bookshelves around the world actually include Remaking Policy, Scale, Pace, and Political Strategy in Healthcare Reform, Accidental Logics, the Dynamics of Change in the Healthcare Arena in the United States, Britain, and Canada, and Policy and Politics in Canada, Institutionalized and Ambivalence. She's the author of numerous articles and chapters on health and social policy, professional regulation, comparative approaches in public policy, and regularly consults for government and public agencies on public policy matters. From 1992 to 2005, she had a number of senior positions at the University of Toronto, including Deputy Provost and Vice President of Government Institutional Relations. She's a Fellow of the Royal Society of Canada, a Founding Fellow of the School of Public Policy and Governance at the University of Toronto. And I'm happy to say over the last few months, I've learned a lot working with her on some of the challenges of science advice during a crisis. Carolyn, over to you.
Thanks very much, Steny. That's a very generous introduction, and it's a real pleasure to be part of this rich conversation. So thank you for including me. Let me just share my screen. So I was a bit surprised when I saw the title of my talk in the advertisement for this panel. It wasn't exactly the one that I had submitted, excuse me, but whoever it was who chose the title knows that I've written a lot about institutional logics, so that makes some sense. So I want to talk about how we can improve the institutional logic of science advice in Canada. Here's a basic overview of what I want to say. And please excuse the frog in my throat. I trust it is merely seasonal. So why should science advice be institutionalized? Institutional logics are about expectations. I'm a fan of my colleague Kathy Phelan's definition of institutions as sets of collectively enforced expectations. And we need consistent expectations about what science advice for policy actually is and how it should be provided in a context when we need to act, when we can't wait for definitive results. Institutions exist over time. They provide continuity and opportunities for learning. Canada has some advantages in institutionalizing science. We've talked quite a bit on this panel about trust in government to use science, and I'll refer to the recently published Welcome Trust study on trust in government across nations, or confidence in government. And we'll see that in the international landscape, Canadians are reasonably well positioned in terms of the degree to which they trust not only science and government, but trust government to use science. We also have a non-politicized public service, which is a not insignificant benefit in contrast to, for example, the US, or even increasingly the UK, although not nearly to the extent of the US. And we have a deep pool of scientific talent, but we also have challenges. Our expectations about the role of science, both in the broad public and amongst policymakers and amongst scientists themselves, are indeed inconsistent. We have a relatively limited receptor capacity in government. We have adopted a generalist view of talent at the senior levels of the public service, which has considerable advantages, but it also means that there's limited receptor capacity for specifically scientific advice. Of course, the Canadian context is marked by federalism and intergovernmental fragmentation that comes along with that. We also have fragmentation within governments in different agencies. And our networks of decision-making are relatively loose. If we look at countries like certainly the Netherlands, or to a lesser extent the UK, we can see fairly strong networks of personal relationships that link scientists, the public service, and broader sectors in society. So in thinking about how to institutionalize expectations, I want to offer two key concepts. What is it that science offers the policy process? It is what Sheila Jasanoff calls a serviceable truth, a serviceable truth. It is a state of knowledge that satisfies tests of scientific acceptability and supports reasoned decision-making, in her words, but it is not primarily aimed at furthering scientific research and knowledge. It's aimed at providing a basis for action in the face of remaining uncertainty. And it requires recognition that dissent lies at the heart of scientific inquiry, and that there is therefore a need to mobilize, to organize that dissent among advisors, to mobilize a sufficient consensus to lead to an actionable result. So two tests for advice: can it withstand scientific scrutiny, but does it also provide a basis for timely action? So the first concept then is the product, the serviceable truth. The process is one of continuing boundary work. I take this phrase from a set of Dutch colleagues who studied the Dutch Health Council, a very deeply institutionalized advisory body in the Dutch context. And they demonstrate and they argue that defining the boundary between science and policy and bridging the boundary is an ongoing process of negotiation. There is no bright line. Science that is too detached from policy can't really contribute, but science that has a pronounced political message risks becoming a part of political infighting. Scientists, like others, have preferences that lead them to study certain dimensions of experience. It requires an ongoing conversation with policymakers to navigate this boundary. So we're reasonably well positioned to think about institutionalizing science and learning from our experience during the pandemic. These are the data from the Wellcome Trust to which I referred. They're actually survey data from the late 2020, although the the study was only recently released. And you can see that along, excuse me, along the y-axis, we have belief in or confidence in government to actually use science. And on the x-axis, we have confidence in government in general. You can see, of course, there's a relationship. And you can see that Canada's in a reasonably good spot. There are different, what Jasonal calls civic epistemologies across nations. Canada's civic epistemology is fairly supportive of the use of science by government, more so, for example, than the UK. Sir Mark, I don't know if that corresponds to your experience. So we're reasonably well placed, but our advisory agencies are fragmented, sometimes competitive, and incongruent with the essential mandates of various agencies. So I'm just going to focus at the federal level with this. If you think of various functions, think about discovery research in health and the Canadian Institutes for Health Research. Think about the public health function, actually delivering public health services. And think about the broader realm of science advice to government with the chief science advisor. In the case of COVID, there has been overlap between these bodies. I would say actually in unhelpful overlap, some competition. CIHR was recently, well, in April 2020, funded for a Center for Pandemic Research, which makes good sense, except that there's also an advisory function in their mandate. The scientific advisor, I'll show you in a moment, has been quite active in the area of pandemic advice. And of course, the Canadian Public Health Agency. Sorry for the wrong acronym there. So here is the chief, a screenshot from the chief science advisor's website, which lists multiple initiatives, multiple expert panels and task forces on COVID-19. Here is a slide from the Public Health Agency of Canada, outlining the Pan-Canadian Public Health Network governance structure, which is a 17-member council, very much an example of our federal, provincial, territorial machinery, co-chaired by the Chief Public Health Officer of Canada and a Chief Medical Officer of one of the provinces. And this actually, this slide, I would say, brings somewhat more coherence to the process than actually exists on the ground. The Public Health Network has a dotted line relationship to the Council of Chief Medical Officers of Health at the provincial level, and much is embedded in that dotted line. A recent study by 3 colleagues of mine for the Royal Society interviewed a number of participants in this process across Canada and observed that early on, federal, provincial, territorial governments appeared to be active in collaborating and sharing data, but cooperation eventually gave way to partnership. It was unclear to our interviewees if public health officers from across orders of government were even meeting regularly, or if first ministers and health ministers were continuing regular exchanges. It seems that the broader problem was a lack of a coordinating mechanism at the center of government. So why don't we think about a new institution? And I know I can imagine eyes rolling. I can't see them virtually, but I can imagine eyes rolling. Yes, let's establish yet another agency in this mix. But let me see if I can persuade you that it's actually not a bad idea. Suppose we had an ongoing institute or agency or council for science advice for health emergencies. Sadly, we know this is not the last. It would draw upon representation from these other spheres, but it would have a specific mandate. It would not be involved in discovery research. It would be involved in providing serviceable truths. It would draw upon the broad concepts of science advice to government, but it would be specific to health. And it would be, of course, closely relevant to public health agency, but it would not be a delivery agency. It would be an advisory agency. It could draw representation from each of these other realms, but it would have its own specific mandate focused on serviceable truths and navigating the science policy boundary and be able to build up experience and learning over time. So why would we, I guess I've just delivered this slide basically. It would have distinctive expectations. It would have distinctive expertise with distinctive networks. It would have the potential to learn from elsewhere. We have the Scientific Advisory Group on Emergencies in the UK. We have the Dutch Health Council, but it would be conscious of the Canadian context and the particular networks that we have. We have specific networks in Canada in the scientific community that I would argue can serve as the connective tissue across jurisdictions that are not entailed with the jurisdictional protectiveness of federal, provincial, and territorial governments. So let's use our scientific community as that connective tissue and build a new institution specific to health emergencies. Thanks very much.
Great, thank you. And I think now get into some of the discussion. I'm going to just suggest that we start off with the first question that showed up in the QA. And folks, if you've got questions, please put them in the Q&A, not in the chat. So the first question, I think, is something that a number of people have touched on in terms of what we expect of scientists. And so Ross Upshur said, I think this is an excellent point about education. We need numeracy, literacy, but we also need argumentation and critical reasoning skills. The latter two are not well represented in bioscience and medical training. What role do you see the humanities playing in helping to face the challenges of pandemics? Maybe, Sir Mark, you raised this point off the bat. I'll go to you first, and maybe Dr. McKenzie, I'll go to you afterwards, because there's a role here as well for your point. Sir Mark?
Well, I mean, I have no doubt at all that the social sciences, the humanities are extremely important. I mean, if nothing else, if we're going to learn from history, we need some historians. And a lot of what we're facing has been faced before. I do want to pick up something that Kwame said, actually, which I thought was, I really enjoyed your presentation. But it did occur to me that the moment Spock became emotional, he would become useless. And so I think what we're really talking about is, and it goes back to that relationship between science and policy making, which is, and I think it turns on Carolyn's point of view in a way, which is that to institutionalize this, you need to have a forum where, as it were, Spock and Kirk work together. And in a sense, that's what has evolved in the UK, in that there is a very hardwired institutional embedding of scientific advice. And that includes, you know, I always used to say that my job was to advise on all aspects of science, engineering, technology, the humanities, and the social sciences, the arts and humanities, social sciences, because that was the job. And the social sciences are extremely important. I mean, one good example I'll give is from anthropology, actually, is in the Ebola outbreak in West Africa, transmission was occurring at funerals. And that's because of the cultural habits of touching people at the funerals to pay respect. And in fact, the higher the status of the individual, the more people touched. And people with Ebola, unfortunately, they're most infectious when they are either dying or just after death. And that's where anthropologists were really helpful in terms of analyzing what sort of cultural replacements could be made for touching, because you couldn't simply say to people, stop touching. It really mattered. But I think that it is about teams. I don't think it's about trying to turn scientists into something they're not. In other words, it's the nature of science that we are actually, if you like, cold and analytical and not too emotional. The second we become emotional, I think that we actually lose some of our power. And what we need to do is operate at teams. And one of the really interesting things that happened, you talked about organizing dissent, which I thought was really good. And actually, SAGE, Scientific Advice Group in Emergencies in the UK, is supposed to do that. And in fact, the great strength of SAGE is it's not a fixed committee. SAGE is convened according to the nature of the emergency. And I suppose that's where I'd slightly pick issue with your idea that you create an institution of science advice in health emergencies, because if you do that, then due to create a science advice institution for flooding or for all the other natural hazards and threats that occur. But SAGE is supposed to organize dissent, but quite interestingly, a group of scientists led in fact by a previous chief scientific advisor, David King, set up something which they called alternative SAGE. It was very, very unhelpful, being frank about it. It was very, very political, with overt political affiliations, which were, let's say, not the government ones amongst the group. And actually that, I think, was not a good aspect of the science advice. But you're absolutely right. I think it's very confusing for policymakers if they get 25 different scientific opinions. And again, I always used to say that the chief scientific advisor, whoever that person is, can only have their own personal deep expertise in a rather narrow area. And so the object of the chief scientific advisor is actually to bring together and act as a transmission mechanism from experts in whatever field it is. And so SAGE is, for flooding, it has a completely different set of experts to coronavirus. And so it's how you actually constitute SAGE so that it provides that forum for organizing dissent. And so those are a few comments on that. But I mean, the arts and humanities are extremely important. It's a question of, I think, getting the geometry right for providing the advice according to the emergency. But I'm not sure simply making scientists emotional. I think that would wreck it, actually.
Great. Dr. McKenzie, I'm going to go to you next, as I promised, and then Dr. I'll come to you afterwards.
I didn't realize that we'd be talking that as soon as you get into Star Trek, we can't stop ourselves. We get into Star Trek. I totally agree with Dr. Walport, the Professor Walport. The point I was making, and probably didn't make very well, is that Spock is part Vulcan. So he's actually the bridge between Vulcan and human. He's somewhere in the middle. And I totally agree. I sort of totally agree that the aim wasn't for, I was being provocative by saying scientists should be more emotional. But in my comments, what I was actually saying is that science needs to understand emotions and values, and then needs to understand the science of emotions and values if it's going to properly be able to give the advice that's needed, and if it's going to be able to understand politicians and understand what they're doing and what they're not doing. And so coming back to Ross's question about education, I think there is a place for education to understand the breadth of understanding of scientists, but I think there's a difference between what you know and what you do. And I think that there's also a need to broaden the base of science so that much more social science is available for policy advice, because you can't be a specialist in everything. And as you know, that's what doctors always try and be. So we end up being amateurs at a lot of things. But there are people who really know how to do this stuff. And it's getting them at the table so that there is balanced scientific advice across the number of different sciences that, for me, feels like the way of giving best scientific advice to governments. Now, what they do with it, that's up to them, but we can make sure that we give the best balanced scientific advice by ensuring that social sciences are properly at the table.
Thanks, Dr. McKenzie. Dr. Tuohy?
Yes, thanks. I wanted to make the point that it's not just scientists who ought to be, whose education we ought to be thinking about here. We need to be thinking about the education of policymakers as well. I speak as someone who is based in a policy school, and mea culpa, we do not give our students, I think, sufficient grounding in science. We have a broad admissions policy, so we do admit students with science backgrounds, and they typically really excel in the Master of Public Policy program. But I mentioned the limited receptor capacity in government. We really need to build that up. We need to ensure that people who are fundamentally interested in policy have at least scientific literacy, and we need to do that. We need to do that much better. If I may use this opportunity to respond to Sir Mark on, do we need a new institution? And yes, I know I've gone back and forth on this. We have essentially two models internationally that I've been looking at. One is SAGE, the other is the Dutch Health Council, which is specific to health. Both of them mobilize expertise as necessary for the current crisis. There are at least 100 members of the Dutch Council that can be mobilized. They are mature institutions. The Dutch Council dates back to 1902. SAGE doesn't have quite that longevity, but I believe that we have an opportunity to do something distinctively Canadian here that can mature in a way that will allow for this kind of mobilization as crises occur. And sadly, I think there will be enough health emergencies, health crises to justify the existence of a separate body. But it's a very good point, and something that I will reflect on further.
Thanks.
All right. Well, there's another question in the chat, which is an interesting one. And Sir Mark, I think it builds a little bit on your opening comments around trust and how trust in science is very contextual. The question's about vaccine diplomacy, and certainly we see a lot of scientific leaders and clinical leaders presenting themselves on social media platforms and making very strong points about vaccination, and it often descends into a polarized conversation, often descends into sometimes patronizing conversations. And we've had some chats at the Dalla Lana School, particularly with Rob Steiner, who believes that bringing journalistic skills to some of our scientific leaders may help kind of guide the discussion. But the question is, what role can science leaders play in the global effort around vaccine diplomacy and in generating greater trust amongst politicians and with the public? Very important question.
You want me to have a go at that, or?
We'd be delighted. Yes, thank you.
Sorry. So, I mean, I think this is a really important social science question, actually, which is how do you influence people? And as it were, the scientific evidence on vaccination is overwhelmingly strong, but how do you get the message across? There's clearly an important role for role models. In other words, different groups of people trust different communities, and they tend to trust people in their own community. So religious leaders, for example, can be quite influential. If you want to advise farmers, then they're best taking advice from other farmers. And so I think part of the role of the scientists is not to, as it were, do the communication themselves, because they're not trained to do it. It's to find the correct interlocutors with different communities. And there, I think the role of the scientist is to actually act as a transmission mechanism of the science, not in this case to the policymaker, but to the social influencer. But I mean, there is such a long history of anti-vaccine rhetoric that this is a very difficult problem to crack. And it comes back to all of the other sort of conspiracy theories that are around as well. So you find the sort of anti-vax movement linked to climate change denial, linked to the various conspiracy theories that, you know, there's microchips in the vaccine, that coronavirus comes from 5G masks, the sort of QAnon. So, I mean, this is actually, I think, quite what the social scientists would call a wicked problem, actually. There isn't, I think, a simple solution to it. There's then the whole question, actually, as to how much should be done by persuasion and how much through coercion, actually. So, you know, different countries are taking different responses to vaccines, from the most extreme version, which is actually you basically make it a statutory requirement, which doesn't go down well in liberal democratic countries, by and large, through to more coercive things, which is if you want to go to a bar or a tavern or a pub, then you can only get in if you've got a vaccine passport. And I mean, that seems to be, having traveled around a little bit over the last few months, now that it's becoming almost possible. Quite a few countries are actually, including Canada, you know, you can't get into a restaurant unless you show you've got to be vaccinated. And that must act as an incentive. But so, I mean, there is a bit of waffle there, I'm afraid, because I think it's a very difficult problem. But scientists are not the only answer. It's got to be professional communicators and people that are viewed as trusted interlocutors. And I think that's the challenge. And actually, if I must just say something to Carolyn, because I think you raised this really interesting question about the receptor function in government for science advice. And I think that's a really profound point. Scientists, academies are always producing really worthy reports, and they drop it on the desks of policymakers and think that something will happen. And it won't, because actually they need to create a customer capacity in order to do it. And so if you want to influence government, you have to create the customer. And that's a specific and concrete piece of work for whatever report you're trying to do. And so you have to socialize your work if you're going to influence policymakers. But anyway, sorry, that's enough.
Well, thanks very much for that. Dr. McKenzie, I'm guessing you might like to get in on this.
Well, thank you very much. I mean, I think I agree with Professor Walport, it takes a village. The idea that scientists are the people that need to be, or always need to be giving this sort of advice is probably erroneous. But also I think that there's another question that we have to ask ourselves is, which is what we're trying to achieve. And too often, certainly you can understand it in a pandemic, but this one is going to run and run. We think short term. So we're looking at short-term fixes. We've got problems with trust. We've got problems with communication. We've got problems with science being apart from certain communities. And we look for a quick fix. So let's teach somebody a few skills in how they can possibly persuade some people. And that might work short term, but is probably not a long-term answer. So there are some fundamental changes we have to think about how we structure access to information, about how we communicate and how we, and that will help us going forwards. The reason I was saying that equity is vital for everything is because it becomes increasingly easy to get marginalized communities on board if they can see that what you do helps them. It becomes much easier. And if they trust you. And at the moment, we've got issues with reach, we've got issues with trust, we've got issues with communication. We actually have issues with networks and not knowing who to speak to. And we believe that if we just shout louder, yes, or perhaps in a more charismatic way, that will solve the problem. It won't solve the problem. It will make an incremental change, but fundamentally, we still have to do the work of developing proper relationships and proper trusted relationships across communities if we are going to be able to serve those communities in a way that really works for all of us.
Thanks, Kwame. I think maybe now turn a little bit to kind of how we learn from this whole experience and how we move forward with a stronger process of science advice. maybe turn to David to talk a little bit about, both your experience reviewing the last pandemic, but also your kind of interesting comment that this needs to be internationally led when we try to learn here.
Thanks, Dana. I'm going to be disobedient and just weigh in on one issue that was raised, and that is vaccine confidence. I just want to flag a side effect of vaccine inequity. So one hears a lot about lack of vaccine confidence in a variety of lesser resource countries, clearly a huge problem that many African nations are taking on. And of course, this will become an excuse somehow to not pursue vaccine equity. And I have a different take, and that is that vaccine inequity actually was a huge erosion factor that led to lack of vaccine confidence. What it meant was there was a sense of momentum for those who were critical of vaccines, a vacuum. If there had been millions of people vaccinated with limited side effects and who were manifestly protected, you would have had, massive counterfactual to the purveyors of misinformation. And instead, by being slow out of the gate with equitable measures of access to vaccines, we created a wonderful opportunity not only for spread of the virus, but for spread of misinformation. So there is a kind of momentum that I think is so important here. Back to Kwam's point about trust. If you get trust building, you get uptake building, then you have a movement that can take hold with community support and advocacy and demonstrated efficacy and safety. And I think we just blew that for much of the lesser resource world, sadly, and we have to now see what can be done to reverse that. Sorry for that, but let me go back to what you asked me to talk about, Steny. I'm chronically disobedient, sorry. On the matter of reviews, what's interesting to me is that this is unprecedented in the scope and scale, obviously, of the pandemic. This is the big one everyone chattered about for years when we were doing SARS. We were all sort of vaguely relieved that more harm hadn't been done and it had sort of drifted away rather quickly. And we all felt that at some point we would have a really major pandemic of the scale we're still engrossed with now. And what's worrisome to me is that the time between pandemics is long enough, or major outbreaks, so that there's such an ample room for forgetting. And the status quo is inertial. It's an extraordinary, powerful force. And the longer we have the status quo, the more people forget what happened. I would like to think no one will forget this, that it's just at such a scale and so disruptive and so tragic that people will be aware of the need to reset and rebuild. But I have to say it does worry me. And it's a catch-22. If it's not a long time between pandemics, it will be even less well prepared, but less time to get our act together. So on the one hand, we all hope that there'll be a long wait. On the other hand, the risk, and this is why I emphasize the need for part of our mission as scientists of all types, I include the human sciences there, the need for all of us to be vigilant, to be advocating for not only for implementation of whatever recommendations come out, but for adaptation, for tabletopping, continued testing of our resilience and responsiveness. As to the international leadership, I just say, every nation in the world has been engaged in this pandemic. We have huge experience to draw on, massive expertise, and I think fresh eyes and fresh look, and a fresh look at this would be very helpful. By all means, let's have Canadian content. We always have Canadian content. That's kind of a thing here. But I think the biggest review, the sort of federal and national review, and I hope it is collaborative and national, difficult thing to achieve in this dysfunctional federation, but that big national look will be led by individuals of great distinction from abroad, so that we can really get an assessment of how we've done and reset and rebuild. That would be my hope. Will there be an appetite for it, further to the market, for the farmer who wanted to know what the market was for the crops, further to Sir Mark's comment about knowing that there is a receptor capacity? The answer is every government's going to have to commission these reviews. There'll be pressure to do judicial reviews, to do more direct accountability and really pin down some failings. Then there will be the broader reviews that are stock taking, that are also, I hope, somewhat unmerciful, but which are more concerned with looking forward to fix things. And I think we're going to see a lot of those. There'll be no shortage of receptor capacity for these reviews in the next couple of years, if, as I hope, we see this pandemic recede over the next number of months.
Good. Dr. Mubarak, I saw you nodding as David was talking, and I want to just kind of get your thought, having sat on many different sort of levels of advice, and how you see this sort of perhaps sustaining and rolling out.
I think one of the things that came to mind was really making more of an effort to include trainees. We see a lot of, there were many times where trainees were excluded from different decision-making processes. And there are some bodies that do this really well and others that have completely neglected it. And when I think about it, I think that really speaks to what you mentioned, Dr. Naylor, about the memory of this. You know, the undergrad students and the graduate students and the postdocs who've been, you know, researching and working the front line of this pandemic are our best hope for the next one, right? So I think it behooves us to maybe include some of these trainees in some of the decision-making processes, if not for, you know, in any other role as an observer. And I failed to really think of a single panel that I'm on that does that. So I think that's something that we could probably do immediately that might help you know, sustain our response for the next one, because there, as you mentioned, there will be a next one, right? And we're going to be relying on the next generation. And the more experience they have at the front line of this one, at the coalface of this one, the better off we'll be.
Naylor, I saw your hand go up.
I just want to second Sam's remarks about getting across the age spectrum here. There is a tendency in all these panels to resort to the gerontocracy, which I'm a proud member as I continue to deteriorate. And that, you know, that I understand that experience and mileage matters, but you know, fresh eyes includes not only international perspectives, it includes mid-career individuals, it includes individuals of a range of disciplines, including from outside the, you know, the sciences that are apparently germane, and it includes younger people. So I really hope the review processes, whether they bake them into the panels or if they have special consultation sessions, that they will you know, take stock across communities, across generations, and help us get to a better place.
Sir Mark?
I want to pick up something that Samira talked about earlier, which is you showed a risk register with a sort of virus on it. And I think there is something very important for the future about how we use national risk registers. And the risk register in the UK had as the top risk by a very long way pandemic influenza. But actually, when you read the text, it wasn't just pandemic influenza, it was pandemics. But risk registers are only useful if you use them to not only to handle things when they go wrong, but prevent them happening in the first place. And I think that one lesson for me is that there'd been too much focus on flu, although it was actually recognized when a committee called NERVTAC was set up, that coronaviruses in 2015 were an important issue. And that was why a MERS vaccine was being developed by the Oxford group, which was then repurposed into the AstraZeneca vaccine. But I think that how nations use risk registers is going to be really important in the future. And one way to do it is because you can never predict what the next future is. I mean, the next pandemic virus, you know, it could be enteric, it could be, you know, an utterly different virus. And so the danger is that we prepare for SARS-CoV-2 and actually get, you know, an enterovirus. And so I think we need to be much more focused on doing scenario planning, which is actually to take the risks and then explore various possible scenarios and how we might prevent and handle them. Because, you know, SARS-1 transmitted late. And so, and that was probably why it came under control relatively quickly. Whereas, of course, SARS-CoV-2 transmits asymptomatically, which is why it's been so dangerous. And of course, as each variant has come out, that's been probably more prominent. So I think for nations, and it picks up on David's point, I think, which is that a country surely needs a risk register and then to actually use that in a way that a good business or any other enterprise would use a risk register to actually stop things happening and to work out how they will handle them if they do. And I think that's one of the failures that there's been.
I might just take a second here. You know, if you think about the variation in how countries have responded, there's also been profound variation in the capacity for science advice and the receptivity to science advice throughout the pandemic. And to be maybe a bit provocative, Canada is a bit immature in this way. You know, it's been over a decade since, you know, the UK actually had advice on giving science advice or guidelines on giving science advice. I'm starting to think about maybe Dr. McKenzie, you want to come in here about how we actually, what do we do in a country that's still somewhat immature in this?
Well, I think there are a couple of things that from the conversation we've had so far is that I do think on the one hand, and now demonstrating I'm a proud Canadian, that actually Canada's response has been fairly good, well, in worldwide terms, right? And so I think that, you know, I totally agree with Dr. Naylor that we need a real, you know, really good review. But I think it's also useful to see what's gone well as what's gone badly. And we also need to be careful with international comparisons. The UK's got great science advice, and in world terms hasn't had a particularly good good pandemic. Sweden went all in listening to their scientist, and that didn't go so well either. So it, you know, but you know, some of that, and so there's a question about how we build science advice on top of what has gone well here, rather than importing something else. And I think a lot has gone well. And I really like the idea, certainly in Canada, of looking across the different provinces and seeing what's worked in different provinces. And every province has had something that's worked well and something that's gone badly. And I do think we, you know, the big question for me is how the federal advice works at the provincial level. And I don't think we've got that working very well. So I think that's where I was going with it, that it's been frustrating, but because we're Canada and because the Canadian people are spectacular, we have actually ridden this out relatively well, and we continue to do so. And the question is, how do we build not just on the science advice, but on the understanding of the fundamental nature of Canadian life and Canadian people going forwards?
Thanks. Dr. Tuohy?
That is such a good point. Although I am a comparativist and I do try to learn from international comparisons, I also always emphasize the importance of the context-specific nature of policy making. And so we do need to look at what worked and what didn't in Canada, and whether there are things that we can learn from elsewhere. I think to round back to the importance of education in all of this, I want to speak to the role of the universities in this regard. And Steini, maybe even ask you about the Pandemic Institute initiative as something that cuts across disciplines in the university and that could actually bring together students in a learning capacity, students and trainees in a learning capacity across disciplines to focus on better preparedness for the pandemics of the future. I think there's a really significant role for the universities here, and we don't want to lose it.
Well, maybe just make a couple comments. Yeah, I think you've got two challenges here, right? One of which has already come up in the questions as well, about whether or not public health and the questions that occupy people in public health get enough attention, enough support. And I think unless there's a pandemic, they tend not to. That's maybe just the nature of being in the business, which is fine. But then I think there's also the way that the academy writ large can actually support more engagement. You know, engagement of the type that Sir Mark talked about, right? Of providing advice, engagement of the type that Dr. McKenzie's talked about, you know, through a lens of actually understanding what we want out of our society and not somehow merely objective and a utilitarian leveling up. But this requires actually universities to work differently. It requires them to work actively in an interdisciplinary way. It requires them actively to reward and recognize that type of engagement as a valuable thing and not something to be kind of poo-pooed. And I think it requires a different, getting back to Dr. Upsher's initial question, a somewhat different preparation for scientists so that they can communicate effectively, but also understand what that kind of role is as a scientist, as opposed to, you know, as Sir Mark said, actually, you know, put up or shut up and either run for office or, you know, provide your advice. So I think it does require a very different approach. And it's one that, you know, UT, when we're trying to set up this Institute for Pandemics, we're trying to cultivate that across a number of faculties. And I've been really happy that we've seen everyone from social work to arts and sciences to philosophy to management want to engage on this, not just the epidemiologists and the infectious disease experts. Dr. McKenzie, you want to come in here?
Yeah, just a very quick story just to support what you were saying and talking about going back to the future. I had a wonderful mentor from Harvard who was trained as a doctor many, many years ago. And when he was trained as a doctor at Harvard, there were no slides. There was obviously no Zoom. There were no slides. There was nothing like that. But part of their training was that was oratory. It was considered reasonable to expect a doctor to be able to get up in a town hall and speak for 30 minutes without boring people silly. That was part of the training, yeah. And you were trained to do it. And, you know, doctors of his age, and he was in his 70s in the 90s when I was there, they did it brilliantly because they were taught. And it is reasonable to assume that there are a set of skills which are a part of that should be part of what every scientist is able to do, and being able to reasonably communicate with the general public is a reasonable thing to expect. Not everybody's going to be a master at it, but being able to communicate reasonably, I think, is a reasonable thing to expect. And I agree with you, Steny, it means that universities have to change what they do and what they value.
Thanks. Last quick question. We've already talked about different generations coming from Dr. Jeffrey Anderson. We talked about the huge intergenerational impacts. How do we engage the younger generation in the review and our future responses? Any quick questions or snappy responses from folks before we close off? Sir Mark?
Well, I mean, we just need to build on the engagement, because there's no one that's not been engaged over the last couple of years. And so I think what we need to do is build on that. But I just, if I may, respond by agreeing very strongly with what Kwame said about different nations. You know, in spite of the UK's good science advice, I don't think the UK's had a particularly good outcome. And the correlation between the science advice and the outcome isn't necessarily a very close one. So, and I think it does come back to, at the end of the day, the policymakers are the politicians. And I think you can probably distinguish the more libertarian governments from the more utilitarian governments, and societies as well. And so societies with very strong social solidarity, with utilitarian philosophies, have tended to do better. But there's also been, you know, just frankly, chance geographical issues as well. Much easier to isolate yourself if you're in New Zealand than if you're in a global hub country with a high population. So, I mean, I think, you know, some of this is down to natural, biological and demographic factors as well.
Dr. McKenzie?
So just two quick things. First thing, in Europe, there is a direct association, correlation between the Gini coefficient and the rate of deaths from COVID. Very clear. And the second is, it's amazing what youth will do if you ask them. And so if people want to involve youth, let's go out and do it. And I think that the fact that we haven't, I totally agree with Jeff's question, we need to do more to engage youth. They'll come out with innovative, interesting, exciting ways to think about this, but we have to ask and we have to support it in this properly to make it worth their while. And I think it's a really great suggestion.
Thanks. I'm going to turn to, David, last comment from you.
Yeah, I just want to flag the intergenerational point. We've seen the pandemic bear down very hard on the elderly, the combination of congruent settings and biology. But I think that we have to pay a lot more attention to individuals in primary and secondary schools who are kind of the hidden victims, despite the relatively lighter footprint of infection and severe illness. The disruption of, well over a year of schooling in various ways for very large numbers of children around the world is something that I think is going to have knock-on effects that we only dimly understand. I think we need a big push to study those cohort effects to make sure that we mitigate any harm that might come from students not being prepared, not having kept up, having been turned off in that period of suspended animation for schools. And it's that's something that actually worries me and that I hope we do not lose track of as we start to think about the follow-up. We can't just focus on the public health machinery. Obviously, we want to focus as well on population health broadly writ, and part of that is going to be the health of a generation of school children and how they fared and how they are faring in the years ahead.
Great, thank you. I'll turn now to Dr. Simpson, my co-chair, for a few quick closing remarks.
Thanks, Dr. Brown, and thanks to everyone. I think this is probably the best 2 hours I've spent in quite a long time, and I've spent a lot of pretty interesting 2-hour periods over the last couple of years. So thanks to you all, and to everyone who's joined in to listen and participate. Lots of really good stuff here. I was really particularly interested in the issues around trust and how complex and layered an issue that is. The notion that scientists don't have a monopoly on wisdom and that we need to understand policymakers' roles, what the policymakers need from us, understanding the lenses through which they see the world. The primacy, I think, of equity as a goal that I think we need to, move beyond virtue signaling and into real action, and using our channels and our knowledge generation processes to feed that agenda. The importance of processes and maybe even new institutions to help set us up for future success. How to be vocal citizens, but not noisy citizens, I think is the way I would summarize the conversation around that in an increasingly polarized and we'll say noisy advocacy environment. And then the last few comments around young folks too. And I think that's a really important point, because we know that a lot of our younger scientist colleagues are still being asked by us to wait their turn and earn their stripes and get their promotions and get their awards. And we need to really have a fundamental conversation, I think, about the importance of wisdom, which is something we all arguably have, versus the kind of power that can be brought with disruptive knowledge generation. And the younger generation are very good at that, with things like hackathons and other sort of unconventional ways of having discussions and generating new knowledge. So thanks again to everyone. This has been very enlightening, and I've enjoyed it very much.
Thanks, Chris. First, thanks to Mark for braving the travel across the Atlantic and whatever sort of risk of quarantine and other things that you were willing to tolerate. Thanks very much to our panelists, Dr. Naylor, Dr. McKenzie, Dr. Mubareka, Dr. Tuohy. Really appreciate the discussion. Thanks to my co-chair, Dr. Simpson. Thanks very much to Obadiah George, who made sure that this all went off smoothly and is a constant calming influence in my life in this world of Zoom. And a very big thanks to Dr. Angel for partnering with us on this and giving us the chance to do this together today. I think that brings us with 8 minutes we can return to you today. So that's a little gift on what I'm sure is a busy Tuesday for folks, and have a great day.